It's one of those things that a lot of people don't like to talk about, or they certainly put it off, but stomach discomfort brought our next guest to the ER. Instead of dealing with her stomach, though, surgeons did bypass surgery. Dr. Cesar Nahas, cardiothoracic and vascular surgeon with UT Physicians, explains the importance of tuning into your body. It's the reason why Edwina Lewis is alive today.
Dr. Nahas, a lot of people mistakenly believe that heart disease is a man's issue when really it's both.
Of course, it's so not true. Heart disease affects women pretty much just as much as men. The issue with women, sometimes they're not diagnosed correctly and quickly enough, because sometimes it's assumed that it's something else, but they're definitely affected.
A lot of the symptoms we hear about are like the tightness of the chest, or like it's almost like they can't breathe. But really, women and men can present differently, but people can present differently. For example, Edwina, when you went to the emergency room, what brought you there?
Digestive problems.
What were you feeling?
For 3 days, I had black, very watery diarrhea in massive quantities. So I knew that it was blood.
Yeah. And Dr. Nahas, people would obviously think that that was some other issue, but being obviously an experienced surgeon as you are, you recognize that that could be a sign of heart disease.
Well, it could be not necessarily the diarrhea, but certainly abdominal pain can be a sign of heart disease. Remember, the heart kind of sits on the top of the stomach, and sometimes if the lower part of the heart is affected, it can definitely give you abdominal symptoms. And not all the symptoms that she had were from her heart, but definitely there was a number of them that was because of the heart.
A lot of heart disease symptoms, for example, the swelling of the ankles, we mentioned the shortness of breath, but stomach issues, and then just, aches and pains. A lot of times we think that could be a sign of something else and we ignore it. Like, for example, it could be thyroid, for example, quick weight gain, thyroid. And so we ignore it. This points to the fact that it is so important for us to not do the guessing and to make our way into a doctor.
Absolutely. It's so important. So many symptoms can just be present, and you don't have to wait for the crushing chest pain and the typical things that you see in movies. Sometimes it definitely can be sometimes very subtle, and sadly also sometimes you can have a heart attack without even having any symptoms. So you have to pay attention.
Yeah. Edwina, what did you think it was? Did you have any idea when they said, hey, you got a heart issue? Were you expecting that?
I'd had a heart issue for a long time. I think I'd been misdiagnosed with it. 30 years ago or so. I was told I had a mitral valve prolapse. And so through the years with having angina pains, I got to where I just didn't pay any attention to them. And when they told me I had a heart issue, they seemed a little bit grim about it. So I started getting a little bit concerned. And then they started telling me what was going on.
Dr. Nahas, when she says, for the past 30 years, the nice thing about this is that technology has changed a lot. What did you do for Edwina? And when you got in there, what was happening with her heart?
She had a little heart attack, but also what we found is that her heart was quite weak. And then when we started doing more testing, we found out that she had some blockages in the arteries to her heart, which was obviously causing a lot of the symptoms that she's been having for years, as well as the weakness of her heart muscle. So basically, the valve was not too terribly bad, so we didn't have to do anything about it. But the blockage in her arteries to the heart is what was causing a lot of the problems.
And Edwina, I should say, how do you feel today?
I feel very well. Thank you.
Yeah.
I had good care.
And for us, that's music to our ears. We know that you are a music teacher. You're also a musician. And so you were able to get back to what you love. Explain to folks, I know a lot of people are putting stuff off right now. They're thinking it's nothing, it's nothing. Explain to them why you want to encourage them to please let the doctor decide whether it's serious or not.
For me in my life, my critically important values are my children and my grandchildren and my husband. And where I would let something go for myself, when I think about what it means to them, I have to have it taken care of. So if you care about those that you love, you're not going to put it off. You're going to seek out the expert. I'm not the expert.
You're an expert at music, but not at cardiovascular surgery. All right, Dr. Nahas, as it typically goes, oftentimes women will take care of everybody else but ourselves, and then men are the ones who are like, I'm not going in. It's important to do so, and even during the pandemic, it's safe to do so.
You know, it is. I mean, there's no question that, unfortunately, a lot of people, because of the pandemic, just ignore their symptoms, and they're too scared to go to the emergency room and to the hospitals. And that's understandable, but unfortunately, that's not always the best decision. We take a lot of precautions, and we try to make things as safe as possible, and I think we do a fairly good job with that. And it's important not to ignore those symptoms, otherwise you'll end up with a much worse problem, you know, sometimes a few days or hours down the line.
All right, thank you very much. And Edwina, I look forward to hearing a concert from you, because you play how many different instruments?
A few.
A few. Yeah, you're a whole orchestra, I understand. But Edwina, thank you very much. Dr. Nahas, thank you.
Thank you.
And for more information on UT Physicians and to book an appointment, you can call this number, 888-4UT-DOCS. That works out to be 888-488-3627, or visit utphysicians.com.